Myself such time as I may consume. I would like, with unanimous consent, to put in to the record an editorial from today's New York Times, which concludes by suggesting that the bill does not require the H.R. 4 doesn't require the Secretary to negotiate prices for all 4,400 drugs used. A smart secretary could simply determine which prices paid by the plan seem most out of line with prices paid by other purchasers and then negotiate only on those drugs. The private plans are explicitly allowed to negotiate even lower prices if they can. This sort of flexibility would pose no threat to the free market. It's time for the Medicare drug program to work harder for its beneficiaries without worrying so much about the pharmaceutical companies. Then I would also like to respond to what I'm sure one of the previous speakers was not an intentional fabrication or misstatement, just probably a remark due to the inability to read a bill and understand what it means. And it is correct that in 2000, our motion to recommit had some wording that limited interference by the Secretary. But it's also important to note that it was a completely different bill. And as such, the motion to recommit had no relationship to this bill. And to suggest otherwise is an outright lie. And I let it stand with that. If anybody would like to see the previous bill, we have information that will cover it. I rise in support of H.R. 4. It's a simple, straightforward bill that should pass by unanimous consent if the members of Congress want to help senior citizens rather than the special pharmaceutical interests. The bill rights a wrong included in the Prescription Drug Act passed in 2003, and it takes away the special interest protection that prohibits the Secretary from negotiating to get better prices for Medicare beneficiaries. The present law includes a flat-out prohibition against using the negotiating ability and clout of 43 million Medicare beneficiaries to get better prices. That's wrong. We don't prohibit the government from negotiating prices for airplanes, even for oil royalties in the Gulf, for highway construction, or for anything else the government purchases. Our bill today eliminates that prohibition and goes one step further. It requires the Secretary to use the market strength of Medicare's 43 million beneficiaries to negotiate better prices for seniors and people with disabilities. We had to go further than simply eliminating the prohibition because the current administration has been so vocal in their opposition to using this tool, even if given the authority. Indeed, they've threatened a veto. Countless studies show that Medicare beneficiaries are not getting very good deals on their prescription drug prices. The Bush administration has shown their ability to negotiate discounts on other drugs. Secretary Thompson did this twice, once when we had the anthrax attacks, and then again when we faced a flu vaccine shortage. This change shouldn't be controversial at all. It's a change that's supported by over 90% of the American public, and its change should lower taxpayers' and seniors' expenses. It's a change supported by advocates for Medicare beneficiaries, the physicians who care for them, and the community pharmacists who fill their prescriptions. It's a change that's even supported by AARP, which I continue to contend wrongly endorsed the Republican bill in the first place, but even they agree that the government should be empowered to negotiate better drug prices. The only interest standing up against this legislation are the same interests who got the prohibition on negotiation included in the first place: the pharmaceutical drug lobby and those whose campaigns they funded. Those days are over. Congress is no longer about special interests. It's about the interests of the American people, and that's why we brought this bill up as part of the first 100-hour agenda. We urge the President to reconsider his opposition to it and to work with us to get Medicare beneficiaries a better deal on their prescription drug prices and to get a better deal for the American taxpayers. It's an important first step in our goal to improve the Medicare prescription drug program for seniors and people with disabilities. I look forward to working with my colleagues and with the administration to improve the Medicare program. I reserve the balance of my time.